All right, today we're going to tackle a medical mystery. It's one that often creeps up with really subtle clues, like a clumsy walk or maybe some weak hands, but it points to a pretty serious problem that's hiding right in the neck. So just imagine this for a second. Someone starts having a little trouble with their balance. Their walk gets a bit unsteady. And around the same time, they notice their hands are getting weaker. Maybe they're dropping things more than usual. Now, these two things, they seem totally separate, right? I mean, one's in the legs, the other's in the hands. But as it turns out, they are absolutely two sides of the very same coin. And you know what's so tricky about this is it doesn't just happen overnight. The very first sign is usually this really slowly progressing difficulty with walking. It's so gradual, it's actually super easy to just write it off as, oh, I'm just getting older. And that is exactly why it's so often missed in its early stages. So if it's not just getting old, then what is this mysterious thing that's causing such a weird mix of symptoms? Let's go ahead and put a name to the culprit. The culprit is something called cervical myelopathy. Now, I know that sounds super complicated, but the idea behind it is actually really simple. Just think of your spinal cord as this information superhighway. Well, cervical myelopathy is basically a huge traffic jam, or like a pinched cable right there in your neck, and it's messing up all the signals trying to get from your brain to the rest of your body. So what's causing this traffic jam in the first place? Well, most of the time, it's a condition called spondylosis. This is really just a fancy term for the age-related wear and tear on our spine. Over the years, these changes can cause the spinal canal, that's the tunnel protecting the spinal cord, to get narrower and narrower, putting the squeeze on those vital nerves. And this brings us right back to that link with aging. It makes sense then that this condition is most commonly found in people over the age of 55, right around the time those degenerative changes in the spine really start to kick in. Okay, now we get to what I think is the most fascinating part of this whole puzzle. How one single point of pressure in the neck can send out two completely different sets of signals to the body. Seriously, understanding this is the key to cracking the entire case. This right here is the central question for any doctor looking into these symptoms. The pressure is happening in the neck, which is exactly where the nerves for the arms branch off. But the signals for the legs, they have to travel through that squeezed area to get down to their destination. So how does that one spot create two totally different problems? And here is the brilliant answer. Think about it like a problem at a major highway interchange. The nerves for your arms are like the local roads exiting right at the traffic jam. They get this weak, disrupted signal, and that leads to what doctors call lower motor neuron signs, things like weak or even absent reflexes. But the nerves for the legs, they're like the main highway trying to get past the jam. The signals coming from the brain get all backed up and scrambled, and that causes an overreaction further down the road. This leads to upper motor neuron signs, like super jumpy, exaggerated reflexes. It is this exact combination, weak reflexes in the arms and hyperactive reflexes in the legs, that is the giant flashing sign pointing straight to a problem in the neck. And it's not just about movement either. This compression also messes with the sensory pathways, so patients will often feel numbness in their arms and hands. They might also lose some of their sense of where their body is in space. That's called proprioception. And they might not feel things like vibration and pain as well. It's a whole system disruption, and it's all coming from that one tiny spot. So, with this really unique cluster of signs, a doctor is going to have a very strong suspicion. But suspicion is not enough in medicine. They need to actually see what's going on inside the spine. The path to getting a firm diagnosis is actually pretty logical. It all starts with a detailed neurologic exam, where they're specifically looking for that telltale combination of arm and leg reflexes we just talked about. From there, the key is an MRI of the cervical spine. This gives doctors a direct look inside, letting them literally see the spinal cord being squeezed. In some cases, a CT myelogram might be used as an alternative. So once that diagnosis is confirmed, the focus shifts entirely to one thing, and one thing only: relieving that dangerous pressure on the spinal cord. So there are two main ways to go about this. A non-surgical approach, maybe using a brace, can help stabilize the neck and manage some of the milder symptoms. But because the root of the problem is a physical blockage, the most definitive treatment is often surgery. The goal is pretty straightforward. Go in there and physically create more space to take the pressure off the spinal cord. And that's really the bottom line, isn't it? Whether the surgeon is removing a little piece of bone or a bulging disc, the goal is always the same. Turn a state of compression into a state of decompression. It's all about clearing that traffic jam so the information superhighway can get back to working properly. So if there's just one thing you take away from this explainer, let it be this. Those seemingly contradictory signs, the weak reflexes in the arms and the over-the-top reflexes in the legs, they're not a contradiction at all. They are the classic, definitive clue that should immediately make a doctor think of cervical myelopathy. And this all brings us to a much bigger question. Cervical myelopathy is so closely tied to the natural process of aging. And as we all start living longer, we're just going to see more of these kinds of slow, progressive conditions. So the real challenge for all of us is, how do we get better at spotting these subtle signs early on before they cause damage that can't be reversed? How can we all learn to listen just a little more closely to what our bodies are trying to tell us?